pushed together slightly. If you've got a tray that's a bit too big, the key thing to do is to stop the patient from opening too wide. Okay, so if you open really wide, I can't get it in. Okay, but if you close slightly, it goes in fairly easily. So that's good. The most important thing is to ensure that the temperature of the alginate is correct. If it is too runny, too hot, it will set too quick. If it's too cold, it will take too long to hold down the patient's throat. So I think the correct temperature for taking the alginates is round about body temperature. So what you want to do is get the water so that when you pour it, the first thing to say is don't take the temperature by putting your hand in a glove and then putting that in there, because that ain't going to tell you anything. So use what they use when they are testing the baby's bottle, sensitive with the arm, and when you pour that on your skin, ideally you should feel wet, neither hot nor cold. Now the point about doing hot is that when we get this right for one impression, we don't want to have to go through the whole process again. If we get it slightly wrong for one impression, then it's easy to make it a bit hotter or a bit colder. So we have a reservoir of water that we're going to use and a wet arm. Next thing is we've got to put the adhesive on the trays. So you want a very, very thin layer of adhesive. We're going to take the lower first, because if we get it wrong, we've got a better chance of adjusting the temperature for the upper, and most people, not everybody, find the upper is a bit more difficult than the lower. Most patients. So you can use a 3-in-1 syringe to dry that off, or we can give it to the patient and say wave that around a lot. Like all adhesives, less is more. The thinner the layer, the better it will adhere the impression. But having an impression taken is not easy for the patient or for the dentist, so it would be nice if we get it right to begin with. Put the lid back on, otherwise it can be messy. Give it a bit of a shake, so it's not going to press down. So a scoop. Don't pack it down, just put the fat across the top. Gentle stir to begin with, so it doesn't fly around the room. Now we go into full Mary Berry mode. So you're using the spatula not to stir it, but to squeeze it against the bowl. Out it comes. Lower impression first. There's a bit on there. Get rid of the air blows. Say to your patient, you've got to open too wide. Lift your tongue up to the top. Close up again. Not quite so hard, just squeeze it in. Okay, alright. Obviously you should have plastic. If I take a decent impression, she's not going to mind me blinding her. Give your patient some idea, she knows if she's a dentist. About another minute, maybe 2. Just release it from there, nice and wide, and look at that. Okay, right, this is important. Everybody puts that down like that. If you put it down like that, you'll lift the heels. So it's counterintuitive, but put that down until you've had a chance to cut off those excessive bits that will lift it away. put it down that way. There is an acupuncture point which is meant to stop retching, so I'll show you how to apply it yourself, alright? Whether it's real or whether it's just a distraction, who knows? But in my experience, about 50% of people who are really serious retchers are significantly helped by applying thumbnail, and you apply your pressure to there. That's the acupuncture point. So when I take the impression, you press that there, and for some reason or another, for about half the people it helps. So stirring, you've got a big blob of stuff, now we start working it. And the idea is that you try and rotate the bowl in your left hand while squeezing the alginate against it with the spatula in your right. Send your retcher, that's it, well done. Make it really wide, close it slightly. Okay. Slowly take it up, have a little look inside, make sure you're not squirting it down into the oropharynx. Give the patient some idea again. Depending on what kind of impression you're taking, you've obviously got to trim it in the patient's soft tissue. 30 seconds. Right. Okay? Done. So, not so bad there. That probably is safe to put down that way. I'll show you what we do with this one. Out of habit, I still put it that way. Before you send it off to the lab, take off that bit, which is adding nothing to the impression, except a lever by which you can distort it. Okay. Job done.